Chelsea, and I'm going to be your nurse today. Today we are going to be doing a cardiovascular and peripheral assessment. And to start off, I have two quick questions to ask you.
Okay.
Do you have any history of cardiovascular disease?
No.
Perfect. And do you have any recent chest pain or anything like that?
No.
Awesome. Well, then to start off our assessment, I'm going to have you lay back and turn your head to the side. I'm assessing the veins in his neck and looking to see that it's flat and not bulging or visible, and it is. So that's a normal finding. You can go ahead and sit up now. And now I'm going to palpate his carotid artery, which is midline of the neck and next to the trachea. And I'm feeling for a normal, smooth pulse. And I'm feeling that on both sides. Next, I'm going to listen to the artery with the bell of my stethoscope. All right, and I'm going to have you breathe in, out, and hold. Perfect. One more time, breathe in, out, and hold. Perfect. And so I heard no bruise with that, just a normal rhythm and rate, which is great. All right, next I'm going to take a look at your precordium, and I'm looking for a regular movement of the chest with each inhalation, no abnormalities, symmetry, and everything, and I'm seeing all of that. I'm going to listen to your heart sounds now. The first one I'm going to listen to is the aortic valve, so I'm going to find the midclavicular line and the second intercostal space, and I'm going to listen to that with my stethoscope. Perfect. And moving on to the pulmonary valve, second intercostal side space, midclavicular line, listen to that as well. Okay, and I'm moving down to the mitral valve, fifth intercostal space, midclavicular line. And then moving over here to the tricuspid. And what I was assessing for was S1, S2 heart sounds, the lub-dub. I heard both of those along with no murmurs or extra sounds, which is a normal finding. I'm going to palpate now the apical pulse, which is the midclavicular line, fifth intercostal space. And I'm feeling a smooth rate and rhythm, which is consistent with my earlier findings. Okay, next I'm going to assess your peripheral arteries by having you just extend your arms in front of you. And I'm going to do a visual inspection. I'm looking for any lesions, cyanosis, jaundice, etc. I'm feeling with the back of my hand to test for temperature. It's warm throughout. I'm going to check your cap refill on each of your fingers. So you turn over. Less than 3 seconds. Less than 3 seconds. And I'm going to now assess your radial pulse. I'm going to assess both pulses at the same time to see for symmetry. And I'm sensing a smooth rhythm and rate with the +2 pulse. Next, I'm going to move on to the ulnar pulse, which is on the inside of the wrist. Assessing both at the same time. I'm feeling a +2 pulse with a smooth rate and rhythm. Next, I'm going to move up to the brachial pulse. You can just relax your arms for this one. I'm assessing both at the same time. Once again, I'm feeling a smooth rate and rhythm with about +2 strength. Now, moving on to the legs. I'm going to have you extend your legs just a little bit for me. You can leave them laying down. I'm going to do a visual inspection, looking for any lesions, cyanosis, scars, etc. I'm not seeing any of that. I'm checking the temperature with the back of my hand, and it is even throughout. The pulse I'm going to be looking at on his feet are the dorsalis pedis pulse. And I'm going to assess both of those at the same time. I'm feeling a +2 strength with a normal rate and rhythm. Moving up, I'm going to go to the posterior tibial pulse, which is on the inner aspect of the medial malleolus. And once again, I'm feeling a +2 strength with a normal rate and rhythm. The last pulse I'm going to be assessing is the popliteal pulse. And was behind the knee. Just gotta find it real quick. And there is And I'm once again feeling a +2 pulse with a smooth rate and rhythm. All right, and that is, oh, and last but not least, I did an overall assessment. I did not find any edema anywhere as I was assessing, and that completes our assessment. Thank you.